Good afternoon, everyone. Thank you for being here. Get through some things. I'll update everybody on numbers from the weekend as well. Some of the numbers. I know that we released numbers over the weekend, and but we'll reiterate some of those. Certainly a busy weekend, productive weekend for the community, I thought. So happy how things worked out. We're still in a fight with the virus. Many members of our community, the members who can least afford to have this virus, some of them do. And we have lost some neighbors over the weekend. We have had one death in the hospital since yesterday, an African-American man in his 50s. The other neighbor who we lost over the weekend, she was a Caucasian female in her 60s, and then we had a neighbor of ours who passed away in a nursing home, according to the state of New York's website. So when we look at how many people we've lost directly related to COVID-19, we've lost 156 of our residents. So certainly want to think about these folks, their families, everybody who's lost a loved one over this pandemic. Very difficult to deal with this, as we haven't been able to grieve together until recently. Haven't even really been able to go to church, any of these things, go to your mosque, your synagogue. So things are getting better. We're making progress, but this virus is still having an impact on our community. When we look at testing and cases, we've now tested 44,883 individuals. 44,790 tests have been returned. 1,035 returned since Friday. There are 2,324 positives in the community since March 16th. That's 19 new cases and 42,466 negative results. So to put this in perspective, we've almost tested 10% of our county. We've had essentially 0.5% of residents test positive since March 16th. We've fared well when you look at those numbers compared to other communities, but it's still been a fight that we've all been in together. We sent out 2,132 tests on Saturday. We have 93 pending tests, plus whatever gets sent today. We have mobile testing going on in Skaneateles today. I know we had over 200 pre-registrations there, and certainly we have testing in other facilities as well. 5.2% of the results we've received have been positive. A reminder, when we were just symptomatic testing, that means testing people that have symptoms of COVID-19, our infection rate was about 8 to 8.4%. We started proactive testing. That started to bring that down into the high 7s, and now we've been doing complete universal testing. And so the numbers have dropped. We anticipate they'll continue to drop as we continue to do universal testing. Our 3-day average on, from the eClair system, the Department of Health, this is when the test results get processed through the state system, and then we start our work to begin to do contact tracing. We have averaged 1,804 tests per day coming back through the eClair system over the last 3 days. Our infection rate has been 1.5%, so the lowest it's been since we've been tracking that. That's very good news. Again, we have a universal testing site at the Syracuse Community Health Center. Again, I want to thank our partners there who've been just tremendous. This is continuing 9 to 5. We will let you know if that's those hours ever change due to circumstances. We talked about how we were in Skaneateles today. Tomorrow we're going to be with our mobile testing site. This is taking our testing show on the road. We're going into different pockets of the community throughout Onondaga County. We're going to try to get to as many places as we can. Tomorrow we will be at Grant Middle School, 2400 Grant Boulevard, in our north side, in between really the north side, Court Woodlawn, and the Eastwood neighborhoods. On Wednesday, we will be at the Solvay Community Center on June 10th. Thursday, we will be at the Blessed Sacrament Church parking lot on James Street. This is right in the heart of Eastwood. So again, if you want to pre-register for an appointment and get a time to come, you can go to the Health Department website to do that. Reminder, 775 tests on average per day for our region is part of the restart process for our economy. Over 3 days, our region over the weekend, and we had a busy weekend, so these numbers are even better. 4,357 tests for our region over a 3-day period, certainly about double than what is necessary. So testing remains robust. Daily average from June 1 to June 7 is 1,765 tests a day for our region, again over double than what our mandate is. When we look at hospitalizations, 70 individuals in the hospital, that's up 1 from yesterday. Out of that 70, there's 35 individuals that are waiting discharge. So when you look at folks who are there utilizing hospital services, we have 35. We're waiting for our partners to give us the green light on 2 different facilities that could temporarily house these individuals so that they're not in a hospital bed, taking up a hospital bed. Remind you, the hospital infrastructure is not strained related to COVID, but other people are sick, and the hospital service everyone else as well. 13 individuals in critical condition. This is on the lower end of where we've been over the last month. Really between 14 and 20 has been what we're seeing. It's going down. That's important. These are our neighbors that are really in a fight, and we certainly need to keep them in our thoughts and prayers, and their families as well. To date, we've released 283 individuals from the hospital, so that's good. That number keeps going up. These are folks that, in their battle with COVID, at one point or another become so sick they need to be hospitalized, but then they get better and they go home. Overall, looking at our positive cases, 2,243 positive cases, up 19. That's a good number overall. Let's break out what the number tells us. 2 individuals out of the 19 are household contacts. Think of this as somebody that you live with. You're COVID positive. You live with 1 person, 2 people in your home. One of them becomes COVID positive as well. This is something that we knew would happen. This is something that individual is already in a quarantine, so the risk of that individual spreading it to the community at large is minimal. So certainly that number has gone down a little bit too. That's good. 12 of our cases related to facilities, particularly senior facilities. The last few days we saw a couple facilities that had new cases. Again, we're seeing asymptomatic cases with employees and residents now in some of these senior facilities. So we're trying to really micro-target that information, make recommendations to the State Department of Health and also to our partners who manage these facilities. Certainly, that number is better than where it was. 3, 4, 5 weeks ago, we were getting 30, 40 cases out of senior facilities almost on a daily basis. That number's cut down. Very good news, because these are our individuals, if they are symptomatic, that eventually become our hospitalization numbers and then our ICU numbers. So happy to see that number going down, and but we need to continue to really monitor that so that we're on top of that. And then that leaves 5 for community spread. We are averaging essentially 6 community spread over the last 3 days in our second week of phase 2. Right now, I think we have not seen any uptick from the original demonstrations that we had over a week ago, the first Saturday, where folks were together protesting. There's no indications yet that we've had cases from that. And so when you look at this number, it will be interesting to see, as I'm talking out loud to everybody, how much better we can really get when the virus is with us, unless the virus is not with us anymore. When you look at not just Onondaga County, but our central partners, you're talking about community spread cases probably in the single digits now. Over is attention to this stat. Hopefully that active cases, Trish, is going to drop pretty significantly here as we're working through some of the contact tracing technology with our health department that we've started. So hopefully that will get updated, and I know we have people calling us who are saying they're ready. So we want to get them back into their daily routines again. Looking at asymptomatic cases outside of our facilities, right now 22% of our cases outside facilities have been individuals who are asymptomatic. Many of the people I stopped by Skinny Atlas earlier today, many of the individuals there getting tested because they're curious. Some of those folks, really 22% right now, have had some exposure to the virus. We don't know enough about how infectious they are, so we presume they are very infectious, and then they go into the same isolation and quarantine as someone with symptoms. When we look at the numbers of cases, a little bit about who they are, 1,386 female, 938 male, 118 under 19, 380 in their 20s, 310 in their 30s, 281 in their 40s, 360 in their 50s, 294 in their 60s, 234 in their 70s, 214 in their 80s, and we've had 133 cases of our neighbors who are in their 90s. Looking at the municipality, again, the first number is the total number of cases. The second number is recoveries. These are from March 16th. That's when we had our first case. City of Syracuse, 1,317 with 649 recoveries. Clay, 176 with 116 recoveries. Onondaga, 137 with 49 recoveries. Geddes, 136 with 33 recoveries. Salina, 101 with 64 recoveries. DeWitt, 85 with 58 recoveries. Manlius, 81 with 60 recoveries. Camillus, 71 with 45 recoveries. Cicero, 71 with 44 recoveries. Lysander, 40 with 37 recoveries. Van Buren, 30 with 15 recoveries. Pompey, 27 with 23 recoveries. Skinny Atlas, 15 with 15 recoveries. Lafayette, 9 with 4 recoveries. Marcellus, 9 with 6 recoveries. Elbridge, 5 with 3 recoveries. Atisco, 5 and 5 recoveries. Tully, 4 and 2 recoveries. Spafford, 3 with 2 recoveries. And Fabius, 2 cases with 2 recoveries. Restart, we can take questions on that. Certainly, we're moving towards phase 3. And at the end of the week, we expect the governor to have some of his policy advisors take a look at our data. They'll be able to talk about the data, look at the data just like we do every day. We communicate the data every day, and what we know is in week 2 of phase 2, we have not seen any spikes. The infection rate is going down. The community spread numbers are going down. Our facility spread numbers are going down. So this is, things are going in the right direction, and we've been encouraging the state to rethink phase 3 a little bit and to try to find ways to yes for businesses that maybe would fall under the phase 4 category, even if you put more regulations. This has been messaging, and we can do it safely because we know the data, and we're a data-driven decision-making body. Again, as we enter in new phases, certainly we're focused and paying close attention to the economic activity. It's critical to local governments and state governments as we are looking at serious budget shortfalls due to the pandemic. June will be a big month for us as we get more data. Maybe we'll have more data at the end of the week here, I'm not sure. But we have decisions we need to make. And so again, we want to encourage our partners, the federal level, who have been talking about helping us to make a decision. If you're going to help us, please do it soon so we have time to assess our own situation, knowing what kind of help you're going to give us, so we can make the best decisions for the service levels that the community demands in our workforce. And if you're not going to help us, that's an answer too. No's an answer. So certainly there will be consequences of all this. Again, I know we'll be working a lot this month with our legislature as we have decisions we need to make locally, and certainly the more tools we have and the more information from our federal partners, it clarifies what really our decisions are. Saying that, our daycare program, I just want to give this number for folks who might be tuning in. If they're getting back to work, they're having child care issues, Child Care Solutions, 315-446-1220. We have daycare slots available and try to help you fill that gap where your children are normally in school. It's getting close. We've been doing this for a while. School would almost be out right now. So certainly we'll assess this program and see if we can extend it after June. But through June, we have slots available for child care for any employee who's getting back to work, 315-446-1220. And again, just want to touch on this. COVID has impacted us all in so many ways that we need to recognize when we need help. And we have a resource with 211 with mental health professionals who can make referrals, can help people get through this process, whether it's for yourself or your family, your children. Please take advantage of that, 211. Saying that, be happy to take questions.
The governor coming out today saying that graduations can start, limited graduations at the end of June. What's the status on that? Have you heard from schools?
Well, graduations is a complicated topic. We're glad to see some flexibility given for outdoor graduations. The reality is the 150 number is helpful for a few districts, but it doesn't get the job done. If you're a superintendent and you're assessing whether to do a drive-by graduation where there's been guidance out, or to try to have a more traditional ceremony. And our office has heard loud and clear from seniors and parents that in many folks, some of these districts are still trying to assess what they're going to do because they want traditional ceremonies. They want that moment for their children, their graduate. And so what we've been asking the state is phase 4 isn't that far away. And traditional graduation ceremonies happen, I think, between the 15th and the 30th of June. We know that that's not phase 4 for the most part. Maybe at the end of it is. But our understanding of phase 4, this process, was that's when gatherings are allowed again. So let's give early guidance and say, assuming you get to your data points to phase 4, which if you are in central New York, there's a high probability that will be there. That at least gives the school districts opportunities to have the discussion with the families of the seniors. Now, some of our graduates who are going to go into military service, they're going to have to go earlier. So maybe there's something that we can do special to honor these folks. But it gives options. And so what we're saying is we know this. We know this is an issue. It's not just an issue in central New York. It's an issue everywhere. In Long Island, talking to some of my colleagues there, they don't have a school district under 300 graduates. And so unless you're planning on doing 10, 15 ceremonies, this doesn't address the request of outdoor ceremonies in what is mass gatherings. And why I think we need to do this and we need to be practical at this point is there are mass gatherings in all our communities. They're happening every day. And we haven't seen spikes from that to this point. We had a very large mass gathering over the weekend. Everybody wearing masks for the most part that I saw, which was excellent. So we need to be practical now. We know these things are happening. We know we're not going to go enforce a mass gathering protest. So if we can do it safely in that setting, in an outdoor stadium where you can really dictate where people sit, I think you can do it safely in that setting as well. So I think as we get into the phases, as we're doing this, we learn more. We know more about where we are with COVID. We know more about where the health data is. And we know after 2 phases of restart how to do things a little bit better moving forward. So I think we got to be a little bit more nimble.
You retweeted a teacher last night that said the crowd size is irrelevant if you appropriately social distance. Do you agree with that it should be an unlimited number of people at a graduation?
Yeah, I think if you're going to, I think we should probably still put there can be no unlimited size and properly social distance unless Syracuse University is offering the dome. Okay, so that, but I think there's a way to have graduation for some of our larger high schools with their loved ones there, and that we should look at that. And even if they were to break it up into 2 ceremonies, 3 hours, a break, 3 hours, these are options and discussions that I think are practical conversations at this point. We can't pretend like there hasn't been large gatherings in the community. There has. And so is there a way for us to do this in a safe way with graduations? Yes. Are we running out of time? Probably, if we don't get some more clarification from the state on if they would allow us to have more traditional ceremonies into Phase 4.
Is this something you could discuss with your health commissioner and make your own local decision as to how to proceed?
Yeah, I do discuss these things with Dr. Gupta. I don't know if we would make our own decision or not. Again, you know, this has been a process where we've always been on the same team. A lot of people pressure you sometimes. Go it alone, go rogue. If I've always said, if I'm asking the question over and over again and nobody's answering the question, I think I've received an answer, is that I need to make a decision. So if we get to that point, we'll assess it at that point. But we started this conversation with the state last week. There's been some movement on it. Hopefully we'll see some more movement. Again, we're talking about Phase 4 when everything else was supposed to be allowed anyways. Let's let the districts know in Phase 4, if you want to postpone your ceremony, you can have a traditional ceremony.
And this goes back to previous conversations about the amphitheater and NBT Bank Stadium. You'd be willing to work with districts using county facilities?
Yeah, again, NBT Bank Stadium is probably a more feasible solution than the amphitheater. When you look at cost, all these things have costs. We're not looking to make money, but we have to cover our costs when we're looking at the budget deficits we have. But yeah, we have a pretty good outdoor venue where we're pretty sure we could physical distance in. Hey, Michelle.
Hi. Can you say more specifically what you expect to happen Friday? You said you expect the governor's policy people to come and take a look, but are you being more active than that, and do you have a real timetable for Phase 3?
Yeah, so I think Phase 3 is it's either 14 or 15 days. So we have not heard specifically if Friday would be that 14-day period. If the state views Friday's data as part of the data review, or if on Thursday they'll take that data and then have the data review, and maybe there's a green light for Friday, or if that's a wait till Saturday. We're trying to get those specifics, but we understand more going into Phase 3 what the governor's process was than we did in Phase 2. So assuming this isn't going to be a data review on Sunday, day 16 or 17, we're comfortable with the process.
What are some of the things that are in Phase 4 that you are advocating to move up to 3?
Yeah, I think there's still some issues related to gyms. Where did gyms fall? When you're talking about public health, we encourage people to go to the gym, and so it's hard to make an argument in a gym, maybe the big gym like this, that you can't have 10 people in the gym working out or 10 people taking a class. And you have professional trainers. There's aspects of a gym operation that what we're suggesting is, can you take those aspects and have them in Phase 3? And please do that, because these people need to be able to pay their rent, and they need to be able to make a living. And we need people to get back and get healthy, and that will be very good for the mental health. So that's one aspect that I think was kind of targeted in Phase 4 potentially, that we think at least put some limits on, put regulations on it. Allow only a certain number of capacity in the gym and regulate it, and then the business has a decision to make if that's feasible for them. So that's kind of what sticks out in my head about one of the business. And you say one of the subjects, because so many people want to get back to the gym. When you look at the communication with our office, you have the business owners and you have all their members begging for progress here. So we've been communicating that and passing on their voice to the state.
What do you think about churches opening a little more capacity yesterday? Did you go to church?
I did.
What did you think of?
I thought it was great, and it was very helpful. We worked, the governor, that was our proposal that the governor implemented, so we're thankful for him to recognize we need to get these faith-based leaders engaged more. They've been engaged with their parishes, but in their congregations, but we have, our community's been tested in many ways over the last 90 days, and we need these leaders. You can't, political leaders can't just be the ones messaging when you're dealing with the issues we've been dealing with. So having them open was really important. In my church, it was done great. I expect nothing less from Father Fred. He was fantastic as usual, and so I think it was a really important thing for the community, and hopefully that will go to 50% in Phase 3 or in week 2 of Phase 3, however they look at.
I wanted to ask you about hotels. They've been essential for rooms, but not for restaurants. When is that in the phase, and what are you advocating there? And would you travel and stay in a hotel right now?
Yeah, I think I would. I think certainly if you're traveling, I would recommend you look at where you're planning on going and how they're doing with the virus. And how serious the community's taking the virus as well, because if they aren't taking it as serious as others, then you might not be getting good information. But I think restaurants and hotels, my assumption is Phase 3. Restaurants are going to be opened up, and that they would be allowed to open up as well.
Do you have numbers yet on your room occupancy tax?
I think our Q1 number was okay. We have not gotten a Q2 number. We get them quarterly, so we'll get them at the end of June. My guess is this will be such a devastating number that I'd be surprised if we're not off 90 or 95% from where we were the previous quarter.
And you make $7 million a year on...
Correct. Correct. Our hope is maybe you get a comeback in Phase 3 to at least maybe try to get you to half your budget. And then in Phase 4, or Q4, assuming this thing doesn't come back, if it does come back, that might limit some of the hospitality industry again, naturally. But you can expect another Q4 being off. But Q3, we're hopeful we'll get back at least more hospitality activity. As like looking at the numbers, I don't know how much better we're going to get than 5 community spread if the virus doesn't leave our hemisphere for another one. That's pretty good. Other questions?
You said there were 12 cases associated with facilities and senior living. What are the other facilities that aren't senior living complexes?
Those are it, Trish. Where all these cases, unfortunately, are driven by senior and assisted living, nursing home and assisted living facilities. And reminder, we use this language and we say facility-driven, not to discount what the virus is doing to our neighbors in that building. And it's actually more heartbreaking when I look at those numbers. But everything, many people that are tuned into what we talk about are looking at it from a viewpoint of whether it's economic restart, how are we doing with the community at large to compare to other communities. So when you look at these cases, every case in one of these buildings is heartbreaking because we know that these people are most vulnerable to this virus. But the threat to the community at large, because of the quarantine the residents are in, and because that the employees are being tested for COVID every two times a week, the threat to the community at large is minimal. And so that's why we look at these through the 3 categories. I've had that question. But unfortunately, at this point, these are the facilities that have driven the cases.
You said there's a backlog of active cases. What is that attributed to, and what do you say to those people who are under
Yeah,
court
I don't know
order
how
stuck
many.
at home?
So what a lot of this is actually, I don't know if it's people waiting as much to. There's some people certainly waiting to get classified as recovered, but many of our nursing home cases have not gone to the recovered section yet, and I think that's an issue with the new tracing system and working through some of that. And so that's really, when you look at our active cases, we're talking about many residents, to your point, who have now been in our numbers for over 2 weeks. So working through that with the state, again, the state regulates these facilities. So once it's on our radar to try to push and get this updated so that that active case number gets accurately reflected.
For the restaurants that are trying to plan to be open, the inside portion, Friday, Saturday, Sunday, Monday, is it just on the state's clarification for when they can go ahead?
Yeah, I think it would be safe to say you should be open by Sunday. Again, you're open right now. I'm assuming all this isn't going to impact many restaurants because you're probably doing curbside, and if you aren't doing curbside or outdoor seating, and the weather's worked out well for these facilities to get a boom into their business. And we had our executive order allowing them to expand outdoor seating, which I've noticed many have. So we're happy with that. We would love to be able to communicate what day earlier so that you can get a Friday night potentially in the restaurant business. We will ask and push the state to allow that, to try to communicate better Thursday. But Thursday's 13 days. So we know 14 days lands on Friday. So if they start reviewing the data on Thursday night, if they're looking at our data, there's not that much to look at right now, assuming it stays where we've been going. So hopefully that will give the green light for the governor to be confident to talk potentially Friday earlier. Yes, you can be open tonight, or you open up Saturday or Sunday for indoor seating. That's what we're talking about.
Did you enjoy any outdoor dining this weekend?
I did. Well, I have enjoyed outdoor dining. I'm not going to tell you when I enjoyed it, but I did enjoy outdoor dining at expanded tables. But it was certainly, it was very nice. Very nice weather. Going to be a great day today. Tomorrow's going to be really nice. So people should go outdoors, get some sun, have a nice meal.
What'd you order?
I had a salad, a salmon salad. As you know, I've been working on my keto diet to the best of my ability, so we're going to try to stay strong on that.
What did you talk about on your regional call today?
Today was about, we had some conversations related to graduations. We still got time to try to work through this. We don't got a lot of time, but we still got a little bit of time. Brought up malls in Massachusetts and Connecticut and Maine and New Hampshire and Ohio and Pennsylvania. Malls are open. So the only one really in the region that is not open is New Jersey. So the idea being we got to open up. There's concerns about traveling from other states in. Everybody's opened up around us, especially in upstate. So we got to get Destiny open. We got to get Great Northern Mall open. Again, this isn't about big box retailers. It's about the mom and pop shops that haven't gotten a paycheck, can't get a PPP small business loan, can't get unemployment, and they're essentially being penalized because of a real estate decision they picked years ago. So in Great Northern Mall, we have 18, I think, small shops, and certainly in Destiny we have quite a few, and we can do it safely. And it's easy to physical distance, so we got to get it done. So I think it's going to be phase 3. I haven't had that confirmed from the state, but that's what I'm feeling.
County Executive, my question's on the confirmed cases chart that you show daily. Each day I look at the map and I see small numbers, and then I also see the white area, which is Onondaga, the Onondaga Nation. How active are the efforts for test taking on the nation, and then also, just that.
Yeah, so with the Onondaga Nation, independent territory, they're our neighbors, our friends. Dr. Gupta communicates with some doctors at Upstate, with the leaders and the clan mothers in the nation. That's their call. We're not, again, we can't, if any testing that anyone on any resident of the nation wants, they can go to any of our testing sites, just like anyone else can. We have not had a confirmed positive case there. I couldn't even tell you, because I don't know who gets tested.
Okay.
So I couldn't even tell you if there's 100 residents of the Onondaga Nation that got tested, they've all tested negative. I don't have that information, nor would Dr. Gupta share that with me. So I know that we have reached out. Anyone is more than welcome to get a test. Thankfully, at least as what the chart shows each day from the information, we don't have any cases on the nation. And that's good. I hope it's because that there's been testing and that nobody has it, but I can't confirm more than what I've just said.
Okay.
I know that you were encouraging protesters, to get tested. You were saying maybe bringing a mobile site down to them. I know that there's still going to be rallies. Anything more
Yeah,
with
we're
that?
going to stick with our strategy going. We have the downtown site at the Syracuse Community Health Center, certainly blocks away from where many of our folks meet up at Central Tech as they start their events. And then we're going to go to every corner of the county, every neighborhood in the city, as long as this virus is with us. So there's ample opportunities for anybody. The protesters don't live in one neighborhood. This cause is a county-wide cause from people of all walks of life, and there's opportunities for wherever any of our residents call home. There's opportunities for them to go get tested close to their homes.
I'd like to follow up that question. More graduations are ahead with more protests and Father's Day celebrations. Would the health department ever add questions such as have you attended any graduations in the past 14 days? If yes, which ones? Have you attended any protests within the past 14 days? If yes, which ones? Because I know you see social media and people say, oh, well, because people are doing this and that, and they're bullying them and things like that. What are your thoughts on
Yeah,
that?
part of the contact tracing certainly is taking into consideration the current events that are new to this process. And so we've always, when we've had holidays, whether it was Mother's Day, Memorial Day weekend, Easter, and Passover, we've always been very cognizant of what that might do to numbers. For the most part, sure, could we trace back maybe a case or two to something that happened that shouldn't? Yeah, probably. But for the most part, everybody has done very well. And I think we'll see in 10 days from this past Saturday, maybe even know a little bit 5 days, but certainly at 10 you know if you're going to see something. We're at day 9.5, 10 right now. We haven't seen anything from the previous Saturday. So at some point, could you contact trace enough back to one person who might have had it at a protest? Sure. Did they get it there? Probably not. They probably brought it there. And the question is, did they then spread it to anybody? And if you're wearing a mask and you're doing your best to physically distance, you're probably going to be okay. So it's the reality. We're making progress with this virus. We know more about the virus now than we ever did. We're doing more testing than we ever had. We're tracing faster than we ever had, and isolating and quarantining. And that's why when you put all this together, that's why you see the community spread numbers going where they are. And that's down.
There's a lot of talk about defunding the police stations, sheriff's office. I know that you don't oversee any of them, but the sheriff's office
Sure.
is in the county budget. What would you have to say to that?
Yeah, look, there's no excuse to damaging public property or private property. Zero. So those are county buildings. That is my responsibility. So we're certainly never going to be okay with any public or private property being damaged. And if there's intelligence suggesting that there might be people trying to infiltrate a cause that's meant to do good for the community, and that intelligence should suggest that these folks are going to try to do bad things, targeting any of our buildings or any businesses, we're going to prepare and plan for that. And that's what we've done throughout the process.
But as far as getting rid of these, taking away money from these, the sheriff's office or police department, what do you think about that?
Look, we're in the middle of a budget crisis, so every department in our government in 2020 has been impacted and will continue to be impacted. I think if you're suggesting the broader policy discussion that I've seen in other communities about defunding different departments, you can't have that discussion without seeing a plan. And I don't know if you were, there's two things, and they can't be either or. Community engagement and investing in people should be done. And we've been doing that in my administration. Before COVID-19, all you ever heard me talk about, and many of you wouldn't cover it as much because you got sick of me talking about it, was our PI platform. That's Poverty, Infrastructure, and Economic Development. And I can point to 10 to 12 things specifically that we did in investments in people, which I think is aligned very much so with the movement in front of us. At the same time, those same people, that same small business owner, that minority business that grows and starts hiring more people, for them to have their storefront shattered because of these other people, who's going to be there to help guard that storefront if we're successful? That's police, right? So it's not an either or. You have to do both, and you need to have both. And I think in our community, when you look at what the mayor talked about, he talked about the Syracuse surge when he became mayor. And that was his plan for inclusive economic growth in the new economy. That's his quote. When you look at our PI platform, why do we talk about poverty? Because we're the government that's in charge of human services. And you talk about our 7 areas where we wanted to have short, mid, and long-term strategies to make significant progress with reducing poverty. When you talk about systems, you're not talking about what is happening with law enforcement outside of this. You're talking about the systems, are talking about opportunity and investment in communities and people that have lacked it over years and generations. And so I know I'm committed to our PI platform, which I think is very much aligned with what many of the protesters' views are, but it can't be one or the other. They got to learn how to work together better, and we need to invest in both.
There's a petition going around for the removal of the Columbus Circle Monument. Like 4,600 people have signed it. It's calling on Mayor Walsh and you to get rid of that monument. What are your thoughts on that?
Yeah, I haven't seen this petition yet. I just heard about it. Certainly this has been a discussion, an ongoing discussion. Their Interfaith Works has been hosting a series of conversations with Italian Americans, Native Americans, folks, many different community leaders about this and how, and I think the mayor started that conversation over a year ago. I think that's an important discussion to continue to have. But again, everything that you ever do, you find balance. And so I think this process with Interfaith Works, I think, I'm not sure exactly where it is, where we'd have to check with the mayor on that, but that was an important process to listen to. So the engagement is exciting, that we're seeing young people engaged and wanting to be stakeholders. We need to figure out ways to get these folks engaged so that their voices are heard not just now but into the future, and so that some of the things that everybody agrees on that need to change can get changed. So we'll continue to be very excited about ways that we can work together on things of this nature. Anything else? Yes.
Governor Cuomo has made a push for, or at least lately, he's made a push for like ending chokeholds by police officers, and then also releasing the name of officers if something happened, and then also for third, maybe criminal history, or not criminal history, or if workplace history,
disciplinary
or something like
history.
That.
Yep.
Disciplinary, excuse me. What are your thoughts on that?
Yeah, I think, look, I think the state legislature is going to act on this, maybe even today. So the chokeholds certainly haven't worked out too well. So I'm fine with that. I think on the discipline history, I don't really know enough about it. I know it's going to pass. So the governor's doing this and that. This is one of the situations that I don't oversee and govern. The sheriff knows more about it. But certainly, if you have anybody in any profession that has a disciplinary record and then an event happens, you're looking at not a one-time incident, you're looking more at a pattern. So I understand the push for that. And so, look, there needs to be reforms. I think they're going to happen. And I think hopefully that will help heal so that some of the communication can happen and we can start doing things more in neighborhoods that traditionally don't view the police department as allies. We can start trying to break down those barriers and do things. I had a former park commissioner, Otis Jennings, reach out to me saying, hey, when he was park commissioner in the Bernardi years, they used to have a softball league with neighborhood kids and police officers, and why don't we do some of these things? And we need to. We need to. We got to do more. We got to think differently about some of this stuff. With this type of activism and people wanting to get engaged, and it's a good time to do this.
With the engagement high, what kind of takeaways do you personally take from it? Do you see maybe things that might be under your control that you could do?
Yeah, what I realize is that, and I had a discussion on Sunday, not this past Sunday, but the previous Sunday, when the mayor and I spoke with a lot of clergy and a lot of different leaders, that some of the things that we're doing that are right in the wheelhouse of what folks want to see, change and investment in, they aren't hearing about it. And so these folks didn't know about some of the things we're already doing, and that's on us. And so we got to do a better job talking about what we do and the investments we're making, and then get feedback. And then we have to recognize as a government, when you do things one way over and over and over, and you don't change, and then you expect different results, that's the definition of insanity. And so that's kind of what we've been doing when we look at poverty, is how it's about economic opportunity. And so what have we been doing? What works? Let's double down on what works. What doesn't work, let's just stop doing it, and let's find something new. So overall, I think this discussion, as it matures in each phase of this with these new leaders, and we got to get them engaged, understand what's going on, so that they can give us feedback from their perspective on what works and doesn't work. Anything else? I want to thank the community. The information and the data is very good, and we wouldn't be there without it. I want to, again, to Michelle's point earlier, it was very nice going to church, have church and religious institutions open, having restaurants, outdoor seating open. We're making small progress, and we're only doing it because of the work we're doing together. And again, I want to thank, over the weekend, I want to thank our local chapter of Black Lives Matter. Very important that the protest went the way it did. Your message grows, and that your movement grows when things work out the way they did. So I want to thank them and thank our law enforcement partners who worked with the chapter to have such a successful event, and really what was critical, that we had the type of weekend we did for the community.